Did your doctor tell you that you need to exercise to help manage your blood sugar, but you're not really sure how to get started or the intensity that you should be working at? This video is going to cover how one exercise session helps to lower blood sugar levels and what that means for exercise intensity. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. Strength training, cardio, HIIT workouts. Any type of physical activity is going to help lower blood sugar, but does the intensity of the exercise matter? Later in this video, I'm going to tell you what type of exercise is one of the most important types of exercise for managing diabetes, including lowering blood sugar. When we talk about lowering blood sugar or glycemic control, there's a lot going on at the cellular level. The term molecular signaling pathway, it's a fancy term that's basically describing chemical reactions that take place in the body to achieve a certain function, like lowering blood sugar. As a quick disclaimer, the research studies that I'm going to be discussing in this video, they've been done in a range of populations, and not necessarily in people with diabetes, but they do give us an idea of how the mechanisms work. The first pathway that I'm going to talk about is proximal insulin signaling. In our cells throughout the body, importantly the ones that are in our muscles, that are in our adipose tissue where the fat is stored, and the ones in our liver, they all have cells that have receptors on them. Now, these receptors are like a lock, and insulin, which is a hormone, is like a key. And when insulin binds to these receptors, this causes a chemical reaction. And this chemical reaction allows the glucose or the sugar to be pulled out of the blood and stored into these different tissues. Insulin signaling is what makes all of this happen, and exercise helps to bind insulin to the receptor. If you're just starting to exercise, insulin signaling can be improved with just one session of moderate to high intensity exercise. Now, you have to keep moving on other days in order to maintain these benefits, but the benefits are fairly instant. Now, for somebody that's been exercising for a while, they're going to need a higher intensity to achieve these same benefits. An easy way to know what type of intensity that you're working at is called the talk test. As long as you can carry on a conversation while you're exercising, you're probably working at a light to moderate intensity. If you can't carry on a conversation, you're likely working at a high intensity. We've seen these improvements in insulin signaling when cycling or using a stair climbing machine for 45 to 60 minutes. It's been tested in strength training, but they only used leg extensions in the study, and they didn't see any changes in insulin signaling. Now, I'm willing to bet that if they incorporated a full body workout with appropriate intensities, sets, and reps, they probably would have had different results, because we've seen promising results in rat studies. To be continued with strength training in humans when it comes to insulin signaling. The next pathway that I want to talk about is adiponectin. This is a hormone that's released by adipose tissue. Adipose tissue is where our fat is stored. Adiponectin has an anti-inflammatory effect. And if you want to learn about how macadamia nuts decrease inflammation, take a look at this video up here. Adiponectin also plays a role in regulating blood glucose levels by activating AMPK, which I'll talk about in just a minute. We've only seen increases in adiponectin when working at higher intensities. When rowing for 6.5 kilometers, which is about 4 miles, this resulted in increases in adiponectin. But we didn't see any changes in adiponectin after doing moderate intensity cycling for 2 hours. For strength training, the way that we measure intensity is typically by percentage of 1 rep max. 1 rep max means the maximum amount of weight that you can lift for 1 repetition, so doing it just 1 time using correct form. There was a study by Fatouros and colleagues that compared 3 different intensities. They used low intensities at 45 to 50% of 1 rep max or 1 RM. They used moderate intensities of 60 to 65% of 1 RM, and then higher intensities of 80 to 85% of 1 RM. And each of these exercise sessions was conducted over an hour. The only group that had any changes in adiponectin was the high intensity group. If you'd like a diabetes resistance t-shirt to help you stay motivated, check out the link in the description below. The third pathway, and stick with me here, is AMP activated protein kinase, or AMPK. AMPK is a sensor that detects low ATP levels. Think of ATP as energy. So when AMPK detects low ATP or low energy, this initiates processes in the body where the body starts to convert glucose or sugar into energy. And that's how it helps to clear some of the blood or some of the sugar out of the blood. Exercise can help to activate AMPK at moderate intensities, but even to a greater degree when the exercise is done at higher intensities. Cycling at higher intensities for 60 minutes showed greater activation in AMPK than cycling at moderate intensities while burning the same number of calories. We've also seen similar results with HIIT, or high intensity interval training. Doing 4 30-second sprints on a bike over the course of 20 minutes also showed activation in AMPK. We've seen a pattern here. Intensity matters. Now, continuous moderate intensity aerobic exercise, more affectionately known as cardio, has many health benefits. But strength training, when done at higher intensities, it's more effective at improving blood sugar levels. Strength training also has added benefits of increasing strength to make everyday tasks easier, increasing muscle mass to help fight against muscle wasting caused by diabetes, and improving balance when neuropathy tries to knock you down. Now, I'm not saying that you should be doing high-intensity exercise training every session, and you should first get physician's clearance for safety. But you can realize the health benefits of doing resistance training or strength training 2 to 3 days a week at higher intensities, and then you could do moderate intensity cardio on your other training days for other health benefits. If you want to learn more about how to design your strength training program, take a look at this video coming up. Thank you for watching, and please subscribe to the channel for more free content.